So one of the most common complaints that people have with back pain is they feel stiff, right? They feel stiff and achy. It hurts to move. First thing in the morning, it's hard to get out of bed. And so what the literature is showing that individuals that have high levels of perceived stiffness, when they actually measure the mobility of their back, their ability or inability to accurately process that information led to an over magnification of the actual stiffness. So when they were assessing, with movement, how much is this moving, and they were actually getting data and their perception of how much it was moving, they were finding that that touch was leading to an over magnification of the actual perception of the stiffness, meaning they felt more stiff than they actually were. In these folks as well, when you look at the site in which they have their low back pain, if you show them pictures and you say, hey, which way is this back rotated, they're unable to accurately identify which way it's rotated. Same thing with touch. If they're trying to localize specific tactile stimulation to that area in the back, let's say they have left-sided low back pain, when they do that compared to the right side, they're significantly less accurate in their ability to differentiate touch. And so what all that means is that when you consider the cortical changes in the brain, in the somatosensory homunculus, which is the area of the brain which is responsible for identifying where we are in space, when you're looking at that body or that region, site-specific region within the brain, there's alterations and there's changes. There's changes evidenced with functional MRIs. And so those are some of the changes that are happening at the brain, not to mention everything that's happening at the spinal cord that's magnifying any type of sensory information that they're getting, which can lead to that over magnification of stiffness, pain, so on and so forth. It's the body's and brain's protective mechanism that is being overly protective. And because of that, it's processing information inaccurately, imprecisely. It's a vicious cycle. So then it leads to, well, I don't want to move, I don't want to do this, I don't want to exercise because it may hurt, or I feel stiff when I do it, I feel like I'm not flexible, so on and so forth. I would probably say no. Not to my knowledge. I'm in the space of physical therapy, and a lot of physical therapists are the ones that are doing this research. The Lorimer Mosleys, David Butlers, those guys who are PhDs but physio trained, and they're some of the guys that are pumping out this literature. What I encounter with my interactions with GPs or orthopods that are referring us patients, in the state of Texas, we can't see patients directly, we still need to have a referral. If we're having this dialogue, they don't seem to have that knowledge base. Even some of my PT colleagues that I work with, oftentimes maybe they're unaware of it. But what I do see is that in the realm of physical therapy, because a lot of this research is coming out in those types of journals, that our group, or the physios, seem to have the most understanding when it comes to what we're discussing. Probably the overutilization of opioids. It has caused a societal misconception from a practitioner standpoint and a patient standpoint that there is such a thing as a quick fix. Also, that pain is scary because if you feel it, you should take a pill to make it go away. Pain is normal, and pain is a normal bodily human function that it helps us to survive. If I put my hand on a stove and I don't feel pain, it's going to burn until there's, permanent damage. I think it goes beyond even just the opioids. It's a societal, cultural misconception and the desire for fast information for fast results, which goes with technology as well and just how our cultures adapt over time. The problem is that everyone wants a quick fix and everyone seems to be afraid of pain, even though we should embrace it because it's quite helpful.